Colon cancer is the second leading cause of cancer death in the United States, and although colonoscopy is not a perfect test, it is by far the best test. However, it's important to note that not all colonoscopies are created equal. You can have two different GI doctors both do a colonoscopy, and one have double the chance of finding precancerous or even cancerous polyps. If you or your loved one is getting a colonoscopy, these are the 4 essential questions to ask before you get it done. These are quality metrics that actually matter. Hi, I'm Dr. Matthew Glover, and I'm a gastroenterologist out in Las Vegas, Nevada. I do thousands of colonoscopies every year. When I get my colonoscopy, these are the 4 questions I'm going to ask my GI doctor. There are measurable quality metrics that can predict how effective and how safe your procedure, your colonoscopy is. Number 1, what is your average withdrawal time? This sounds simple, but the most of the polyps and other pathology, including cancer, is not found on the way in, but rather the way out. The longer a GI doctor spends during your colonoscopy examining the colon on the way out, the more likely they are to find precancerous or cancerous polyps. Guidelines state that a withdrawal time should be at minimum 6 minutes, but with an optimum time between 6 to 8 minutes. This matters because a rushed exam can miss polyps. What questions can you ask your GI doctor? What is your average withdrawal time? Do you track your withdrawal times? Remember that a rushed colonoscopy is a poor colonoscopy. The second question is, what is your adenoma detection rate? There are many different types of polyps, one of which is called an adenoma. If not removed, these adenomas will grow over time and inevitably turn into colon cancer. These are the types of polyps or things we're looking for during a colonoscopy to remove to prevent the risk of colon cancer. Adenoma detection rate refers to the percentage of time a doctor finds at least one adenomatous polyp during a colonoscopy. Why does this matter so much? The higher the adenoma detection rate, the lower the risk of interval colon cancer. In one study, every 1% increase in an adenoma detection rate results in a 3% decrease in colon cancer risk. An aspirational goal for adenoma detection rate is between 40 to 50%, meaning you will find an adenomatous precancerous polyp in 1 in every 2 colonoscopies. The minimum standard, the minimum adenoma detection rate suggested by guidelines in first-time screening colonoscopies is 20% in females and 30% in males, giving 25% overall. But this is the minimum rate. Your GI doctor should aspirationally be around 40 to 50%. Personally, we keep close track of our adenoma detection rate in my practice, and my adenoma detection rate hovers around 40 to 50%. What can you ask your GI doctor? What is your adenoma detection rate? Do you even track your adenoma detection rate? Remember that the more polyps, the more adenomatous polyps that are found, the lower your risk of interval colon cancer. The third question to ask is, what is your complication rate? A colonoscopy is an invasive procedure. It has inherent risk just like anything else, but this risk should be balanced with potential benefit and the risk mitigated to the best of our ability. The 2 primary complications we look for are both bleeding and perforation. Bleeding tends to occur most commonly after polyp removal, and perforation refers to a tear in the colon that typically requires surgical repair. The most commonly cited targets and guidelines for complication rates are about 1% for post-polypectomy bleeding, meaning bleeding that occurs after a polyp is removed, and around 0.1% for perforation, so 1 in every 1,000 colonoscopies. What can you ask your doctor? When was the last time you had to send a patient to the hospital after a colonoscopy? What is your perforation and post-polypectomy bleeding rates? Remember that the best doctors do more and harm less. Question number 4 to ask your GI doctor is, what is their cecal intubation rate? The cecum refers to the very start of the colon, where the small bowel empties into the colon. Whenever a GI doctor does a colonoscopy, you should be provided with a picture or evidence that they either saw the appendiceal orifice, which is within the cecum, or they intubated the terminal ileum. Both of these are landmarks showing that the colonoscopy was complete. An ideal cecal intubation rate is around 95%, ideally even higher. If the cecum isn't reached, then the exam was not complete. What can you ask your GI doctor? What is your cecal intubation rate? How often do you have an incomplete colonoscopy? Am I going to get pictures provided of landmarks showing that you completed my colonoscopy? Meaning, am I going to get pictures of the cecum, the terminal ileum, and or the appendiceal orifice? Remember that if your GI doctor did not reach the cecum during your colonoscopy, it was not a full exam, and polyps or cancer could have been missed. So before your colonoscopy, remember these 4 questions. Number 1, what is your average withdrawal time? They needs to be at minimum greater than 6 minutes. Number 2, what is your adenoma detection rate? A minimum standard is 25%, but an aspirational goal should be 40-50%. Number 3, what is your complication rate? When was the last time you had to send someone to the hospital after a colonoscopy? Number 4, what is your cecal intubation rate? Remember that if they don't get to the cecum, your colonoscopy was not complete and things could have been missed. Most patients never ask these questions, but they should. A colonoscopy is heavily operator dependent, and these questions will help ensure that you are getting a thorough exam so nothing is missed. A good GI doctor should not be offended by these questions before doing a colonoscopy. In fact, they should be happy that you as a patient are invested in your health and should be able to answer them without difficulty. Hey, I appreciate you taking the time to watch this video. These are the 4 questions I recommend you ask. If you have any questions, please ask in the comments below. Otherwise, I'll see you next time.